Yeah, welcome, welcome, welcome. Ask any questions you guys have regarding the heart, regarding health, and regarding prevention. My name is Dr. Isang. Just using this platform to be able to answer these questions, getting ready for my clinic. If you can hear me okay, let me know. Yeah, if you guys can hear me, let me know. And ask any questions regarding the heart. Welcome, welcome, welcome. If you guys can hear me, let me know. And ask any questions regarding the heart, health, prevention. My name is Dr. Easton, cardiologist, using this platform to be able to discuss these things. Right now, I'm just preparing for my next few patients. If you can hear me, let me know. Let me know if you can hear me. And if you have any questions regarding heart health, regarding cardiology, regarding your heart, regarding your blood pressure, let me know in the comments. Welcome, Gina. there are any pressing questions about the heart, about your health, put it in the comments. The best way to lower cholesterol naturally without medications is going to be, number one, is going to be exercise, and then number two is going to be your nutrition. You want to limit the amount of animal products that you're eating. Your body makes cholesterol through your liver, and the only other way that you can get it is through the foods that you're eating. So watching what you're eating is going to be the biggest one. Foods that are high in oats can also decrease the amount of triglycerides and the amount of cholesterol in your bodies too. But the biggest one, other than exercise, is going to be your nutrition and trying your best to eliminate animal products as much as possible. Not completely coming off of it if you can, but reducing it significantly. Can you reverse and enlarge heart through food? You potentially can, just depending on how long it's been going on for. So if it's been going on for decades, it's going to be very hard. But if it's been pretty new, few weeks, few months, possibly, whatever you can do to help decrease that blood pressure. The higher your blood pressure is, the harder the heart has to work. Over time, it can enlarge. So if you reduce your blood pressure, that can help with your heart health overall. Salt content, any foods that have a lot of salt in it is going to be very detrimental to your heart. So biggest thing is going to be watching what you're eating, eliminating, decreasing the amount of processed foods that you're eating, and exercising. Clarice, you're welcome. Gina White, that was a good question. For the people coming in, just answering questions regarding their heart. Had some pretty good questions about ways to lower your cholesterol without taking. I think I'll try to make a video for that just for you. I hope it's Clarice, about ways to lower your cholesterol naturally. And then I'll make another one. Can you reverse an enlarged heart through food? Let me jot those down. Mother and grandmother had an enlarged heart, so probably need to see a cardiologist just to be on the safe side to make sure that you don't have a genetic cause of that. That way, if you do, we can get it treated early before something bad happens. Things like diagnosis of heart failure, heart attacks, and things like that. Yeah, a good history would be beneficial just to see, what caused her to pass away. Was it from heart failure? Did she have a heart attack? Did she pass down any genetics, grandmother to mother and potentially to you? Just so if you do have those genetics, if there's anything that you need to do now to prevent, something from happening in the future. Thank you. Also very inexpensive too, so I think it's Kofandi is the name of it. They should really pay me because that's all what I wear. For any new people coming in, it's Dr. Ethan, just answering questions regarding the heart that you guys may have. So far, I've had really good questions. Those are pretty good, niacin and garlic. Especially garlic. Garlic is good for arteries too. So it's one of those natural ways that you can help your blood pressure. In addition to watching what you're eating, exercising, and not living a sedentary lifestyle. my patients could eat what you eat and do what you do, they live a lot better life. Yeah, living a healthy life is hard, but also can be easy once you have a consistent pattern with it. Once you've developed a habit of it, it only takes about a month to 6 weeks to develop a habit, and once you do, it can become fun. It can become easy. Also, Gina, like when you hear my voice, is it too echoey? Does it sound okay? I usually have a microphone, but I don't want to be wired up and then have to leave and go see patients. So hopefully my audio sounds okay. Hopefully the ambiance sounds okay. I got a little bit of the music in the background to hopefully keep people calm because life can be stressful. Perfect. That's awesome. Since you guys have been my OGs, when I start seeing, well, I guess when I start seeing patients, nah, that probably never mind. I answered my own question. The question was gonna be, because I'll be going in and out seeing patients. Should I stay on or do another live at another time? But I think I don't see my next patient for like another 40 minutes, so I'll stay on here until then, and then have you seen Arnold Hogan? He went to town. I have not. I'm here to answer any questions anybody has. Switch it over here. Raul, what's going on? Hope you're doing well. It's Dr. Isang here, just asking, here to answer questions regarding the heart as much as possible. So just ask away. I'm a non-invasive cardiologist, so I don't put in stents or do anything like that, but bread and butter medicine, heart disease, high blood pressure, heart failure. Those are a lot of the things that I see. Right now I'm just reading some echoes, preparing for the office. Actually, I'm reading echoes for the whole hospital, for all of the outpatients that are unassigned. You may need to see an ENT doctor for that. Sometimes they can look at your nasal passage to see if you're increased risk of having congestion. I was told I needed to see one, but I'm kind of used to it now. It's a lot faster than I wanted it to be. All right, that music is weird. In about 5 minutes, I'll give like an overall spiel with heart health, cardiac health, things I see, concerns, and then I'll be out unless you guys have any further questions. But give me about 5 minutes and I'll give you guys an overall discussion about the world of cardiology and things to look out for. Needs to be on a plant-based diet for apogene. Um, yes, ish. It does increase the risk of cardiovascular disease. Um, I would say the biggest thing is just monitoring what you're eating. You know, decreasing the amount of processed foods that you're eating. Um, Animal products can increase your cholesterol levels, so those can be risk factors. But exercising is going to be huge too, and monitoring your stress too. So it's a multifactorial type of thing too. So staying up to date with your primary medical provider, um, making sure other risk factors for heart disease are being well controlled. Uh, Clarice, thank you very much. Thank you. I have one more echo to read, and then I'm going to give a little bit of a spiel. So, if you can wait, please wait. But if not, definitely understand that. All right. Before I head off, what's going on, guys? My name is Dr. Easting, and I use this platform to educate people regarding, cardiac health, prevention, and just, why it's extremely important. So if you think about it, prevention is a lot better than treatment. If you understand what the risk factors are for heart disease, things like high blood pressure, diabetes, high cholesterol, strong family history, smoking, you can potentially prevent a heart attack from happening. You can prevent heart failure. You can prevent a stroke. You can prevent kidney failure. So it's important for us to remain vigilant regarding this so that we can live a happy and a healthy life. So if you have, high blood pressure, please get it checked. Please get it treated. With high blood pressure, you can treat it naturally. For some people, it's not for everybody. And natural ways to treat it is exercising at least 30 to 50 minutes a day, 3 to 5 days a week. More importantly, just being active 10 to 15 minutes a day can be significantly better than the 30 minutes once a week. So be active in your life. Walk as much as you can. If you don't use it, you're gonna lose it. So staying active is gonna be one of the biggest things. And for women, you want to do strength-based exercise, especially when you get older, because it can help prevent osteoporosis, osteopenia. So being active, watching what you're eating, limiting the amount of salt content that you intake plays a huge factor into it too. Stress, want to treat your stress as best as you can, getting enough sleep, exercising, seeing a therapist, yoga, whatever you need to do to decrease the amount of stress that you're facing. For a lot of people, they can do all of that and they're still having symptoms. So when that happens, You likely need to be on medications for it, a lot of different therapies for it. So I'm not going to go over all of it. If there's a specific one that you want me to talk about, I can. But medical therapies work well. The best thing is to choose the right one for the right individual. There's some that can cause your potassium levels to be elevated. So if you have high potassium in general, it may not be a good one to choose. But if you have low potassium, it may. There are some that are better for African Americans, some that are better for everybody. So choosing the right medication is key, but there are a lot of other things that we need to look at too. For a lot of people, they have high blood pressure due to something else. It can be sleep apnea, issues with your thyroid, issues with other hormones, perimenopausal. So seeing your medical providers for that can be also beneficial. And the last thing I want to talk about is just chest pain because a lot of people have classical symptoms of chest pain, and a lot of people don't. They unfortunately have atypical presentation. They can have shoulder pain, back pain, but they're actually having a heart issue, even a heart attack. So, if you're having any symptoms that don't feel right, feels new, go get seen by a medical provider, urgent care, emergency department, just to make sure that you're not having a heart attack. My name is Dr. Isang, using this platform to discuss things regarding the heart, health, and prevention. I'm going to stay on for about 2 more minutes in case anybody has any questions. If not, you guys have a great day. Thank you. MR doesn't look as bad anymore, actually. Does vitamin E help with angina? I don't think so. Trying to think if, and I don't think so, but I could be wrong. That one I gotta look up because I know it's like good for your skin. um, Maybe not directly, but it is an antioxidant too. So I guess yeah, it potentially can antioxidants, and it can help dilate blood vessels. But it's not the first thing that we reach for. Um, it wouldn't hurt. I guess the best thing is that it won't hurt. Interesting. I use it for my skin all the time. It helps my skin, so if it helps my skin, it can help it. I guess anything else. But I'm out of here. You guys take it easy. I'll be back on probably around the same time tomorrow, maybe.